Are you a male with low T or fertility issues? Do you take ibuprofen chronically, especially 600 milligrams or more? Are you an athlete that uses ibuprofen to help you recover? Well, recent research from the Proceedings of the National Academy of Sciences shows that ibuprofen use causes decreased pituitary gonadal axis function in men. What does that mean? That means that ibuprofen use suppresses testosterone and increases luteinizing hormone, which results in a condition called compensated hypogonadism. In the research, compensated hypogonadism is associated with all-cause mortality, meaning you have a higher risk of death from all causes. This research is very important, and I want to share it with you today because taking ibuprofen is seen by the population as something that, yes, it's a medication, but it's kind of like candy. Everyone uses it over the counter, and there's no adverse, no big time adverse reactions if you're not having an internal bleed or kidney issues. But this research begs to differ. So let's take a look. As you can see here, the study is called Ibuprofen Alters Human Testicular Physiology to Produce a State of Compensated Hypogonadism. That's it right there. But if we dig in deeper, you can see that there's big issues here for men. It says here, fluctuations in or impaired fine-tuning of the axis can result in a wide range of endocrine disorders that may be local but severe, for example, infertility, or affect the entire body as seen with adverse outcomes involving this axis such as sexual symptoms, depression, coronary heart disease or heart attack, autoimmune diseases such as arthritis and diabetes. So what I want to zero in here is look at impaired fine-tuning. So that could be functional changes, not overt pathological changes. So taking ibuprofen could suppress your testosterone, increase the LH enough to, in a specific individual, be enough to cause infertility or cause some of these other issues. So if you're a couple struggling with infertility, oftentimes it's all focused on the female and the male component is not considered, but male infertility is a big problem that is unaddressed. And if it's something as simple as chronic ibuprofen use, then that's an easy fix. As we scroll down further here in the study, we can see that the striking dual effect of ibuprofen observed here on both Leydig and Sertoli cells makes this NSAID, ibuprofen, the chemical compound of all classes considered with the broadest endocrine disrupting properties identified so far in men. So what they're saying is that ibuprofen is a worse endocrine disruptor in men than phthalates or plastic, BPA, another component of plastic, aspirin, and indomethacin. So if you're a male taking ibuprofen to help you recover from training or for chronic pain, and you're having fertility issues or cognitive issues or autoimmune issues or anything listed in this study, you really need to consider if you should stop the ibuprofen and have that conversation with your doctor.